Trichinella spiralis. This parasite is a member of the phylum Nematoda and causes trichinellosis. It is an intracellular parasite that penetrates skeletal muscle cells. It is dioecious, which means having the male and female reproductive organs in separate and distinct individuals. The posterior end of the male worm has a copulatory pseudobursa. The female worm's uterus is filled with embryos and releases approximately 1,500 eggs in the intestine of the intermediate host. Trichinella spiralis can have two types of life cycles, domestic or sylvatic. In domestic cycle of transmission, humans can come into contact with animals such as pigs or rats. The sylvatic cycle is when humans can come into contact with wild animals such as foxes or bears. Now we will give you an example of a trichinella life cycle. Pigs become infected with trichinella when they eat infectious cysts in raw meat. Eventually the worms will encyst in the skeletal muscle cells of the pig, waiting to be eaten by the next host. The next hosts, in this case, which are humans, become infected when they eat undercooked pork. After the human ingests the cyst, pepsin and gastric acid release the larva from the cyst. They then invade the small bowel mucosa and develop into adult worms. After 1 week, females will release larvae. The larva will migrate and penetrate skeletal muscle cells. Then they will encyst, also called nurse cell formation. In this example, humans are seen as dead-end hosts for the parasite because their muscles are not eaten by other animals. Another host that can be infected by eating infected meats are rats. This rat will eventually become infected with Trichinella spiralis and be eaten by another rat. This rat will be eaten by another rat, continuing the cycle of infection.
Symptoms of trichinellosis include edema, fever, nausea, diarrhea, vomiting, muscle pains, inositophilia, death from myocarditis or encephalitis.
There are various ways to diagnose a patient that may have Trichinella spiralis. The doctor may ask the patient what their symptoms are and if they have recently eaten pork. A tissue biopsy can be performed to check for the presence of Trichinella larvae. Another way to check if Trichinella larvae is present in your tissues is by doing a tissue squash. This is a technique where you press the tissue between glass plates and examine the sample through a microscope. Clinical labs may also use PCR, as well as immunological tests such as ELISA.
Worldwide, there is an estimated 10,000 cases of trichinellosis occurring every year. Though in the United States, trichinellosis are reported much less commonly now than they were in the past. During the 1940s, when the U.S. Public Health Service began counting the cases, there were 400 cases reported on average. And now, during the 2008 to 2010, roughly 20 cases are reported each year. Overall, the number of cases reported has decreased because of the improved pig raising practices in the pork industry, commercial and home freezing, and the public awareness of the dangers of eating raw or undercooked meat products. As shown by this graph, there has been a steady decrease of pork products and non-pork products causing trichinellosis, as reported by the CDC. There are several treatment options for trichinellosis. One of them is albendazole and mebendazole, both of which can be used for children and adults. Someone can also be using anti-inflammatory medication to relieve any inflammation or pain that they may be feeling due to the disease.
One way to prevent Trichinella infections is by cooking your meat to safe temperatures. The best way to check if your meat has been cooked properly is by using a food thermometer. You can also freeze pork that is less than 6 inches thick for at least 20 days at -15 degrees Celsius. This will effectively kill the worms, making the meat safe to eat once it is properly cooked. However, freezing wild game meats, such as polar bears, will not effectively kill all the worms. Why? Because some worm species that infect wild game animals are resistant to freezing temperatures and will be able to survive the harsh environmental condition. If you have a trichinella infection, you cannot spread it to others. The only way a person can get the trichinella infection is by eating undercooked meat.
If you think you have trichinellosis, you should contact your healthcare provider who can run the appropriate test to see if you have it.